Fluids and electrolytes. Alteration in fluid status. How can water in the body increase? Well, we can drink it, we can be given IV fluids, and we can retain it. That means not excreting it. How is fluid lost? It's lost through the urine, but we lose electrolytes as well. It can be lost through sweat. And again, electrolytes are lost there, especially salt. We lose fluid through respirations, through feces, especially if we're talking about diarrhea, and through bleeding, such as hemorrhage. With hemorrhage, we not only lose fluid and plasma, but we lose the blood components, the red blood cells, white blood cells, platelets, etc. We lose plasma proteins and electrolytes. Hemorrhage. We lose blood. All components in blood are lost equally. So the hematocrit is going to remain the same. But the person will be hypovolemic. That leads to a drop in blood pressure, which will in turn lead to less blood flow to the organs and tissues. Since there's less blood getting to the organs and tissues, the heart works harder to try and get the blood there faster. So we see an increase in pulse. But ultimately, there's going to be an insufficient blood supply, which can lead to tissue ischemia and damage. Immediate treatment for a hemorrhage is aimed at replacing the fluid volume and blood components. Quite often, we see a blood transfusion. But also, we may give a hypertonic solution to pull the existing fluids from the interstitial spaces and into the intravascular spaces. We're not giving lots and lots of hypertonic solutions because we can end up with too much fluid in the system. But initially, that is what we see sometimes. Dehydration. With dehydration, there's a drop in the extracellular fluid or the intravascular fluid. Or we might see an increase in sodium in relation to the body's water. We are seeing hypovolemia, so again, we're seeing a drop in blood pressure and an increase in pulse. The blood seems very thick or viscous. There's an increase in hematocrit because we haven't lost red blood cells. We just lost the plasma fluid around it. So there's increased concentration of the red blood cells, and we measure that with a hematocrit. Increased thirst, decreased urine output, because the body is trying to replenish the fluid, and it's trying to retain whatever fluid it's got. There's fluid shifting from the cells and into the blood vessels. Now, cells are shrinking because they're dry. We're losing fluid. Once the brain becomes involved in this, we'll see headaches, decrease in reflexes, seizures, coma, and other organ damage. How do we treat dehydration? Replace fluid and electrolytes. Sometimes that means sports drinks because these tend to be balanced, not just water, but electrolytes as well. Hypotonic IV solutions in the short term and isotonic IV solutions in the long term. Okay. Physiologic response to dehydration. This graph is really not as complicated as it looks. Initially, with dehydration, we have an increase in plasma osmolality. That means cellular dehydration. And we've got a drop in circulating blood volume. That's hypovolemia. Both of those messages get passed to and through the hypothalamus. From there, traveling down the left side of the diagram, we see increased thirst. The hypothalamus got the thirst center there, tells the body you need to drink more. So the person is more thirsty. They will then increase their fluid intake and increase the fluid retention, leading to an increased circulatory volume, drop in plasma osmolality, and then we have a drop in the ADH and the thirst. So, let's go to the right side. ADH is secreted from the hypothalamus, which tells the kidneys, reabsorb water, don't let it go. So there's decreased water excreted. And these also lead to more fluid in the vessels, less viscous fluid in the vessels, and then the hypothalamus shuts down on the extra thirst and the extra ADH secretion. Water intoxication. This is from the intake of too much water and not enough salt. We think of that with athletes who have done a tremendous amount of sweating and have just drunk water rather than replacing the electrolytes as well. This results in hyponatremia. They get a headache, anxiety, altered consciousness. They will also end up having hypotonic blood because of the hyponatremia. The cells swell, the blood cells become bloated and impair the blood flow, and we're going to see some muscle twitching and weakness. We have hypovolemia. So we've got not a lot of blood, and what we do have, there's not enough of it. So we again are going to see a drop in blood pressure, an increase in pulse, and a drop in urine output. How do we treat it? First of all, you limit the water intake and increase their sodium intake. So maybe we're going to sports drinks here. Maybe we're looking at IV, hypertonic saline. Maybe we're looking at loop diuretics, which will eliminate the water from the body. The body has too much water and not enough electrolytes, so we're trying to rebalance. Okay, let's go back and remember the inflammatory process. Remember, with injury or irritation, when the inflammatory process kicks in, we have more vasodilation, but we also get increased vascular permeability, leading to swelling. Why does that happen? Okay, inflammations, burns, etc., increased capillary permeability. From there, we see a loss of plasma proteins from the blood. It leaks out of the vessels and gets into the tissues. So we have a decrease in capillary osmotic pressure and an increase in the tissue osmotic pressure. The proteins have moved from the blood system into the tissues. So the fluid ends up being pulled into the tissues and we get edema. But edema can come from other sources as well, such as salt, water retention, heart failure, etc. That will lead to hypervolemia. So we have increased capillary hydrostatic pressure and fluid is getting pushed out into the tissues, and we end up with edema.